Welcome to Medics for Medics. This video will show you how to insert a chest tube for a pneumothorax. This patient has multiple rib fractures. They cause a pneumothorax with a midline shift, forming a beginning tension pneumothorax. Sterility is very important, so make sure you know and follow the standard operating procedures of your hospital. Prepare your table with sterile instruments. We'll be using a surgical clamp, scalpel, and surgical sutures. Use lidocaine 1 or 2% and determine the right chest tube size. The preferred patient position is half-seated with the arm lying aside and at shoulder level. Disinfect the thorax broadly to prevent desterilization. Before draping the patient, define intercostal level 4 to 5 to place the chest tube. Preferably use a broad sterile drape with a central opening. Anesthetize the skin covering the rib that you're using as a reference. Now anesthetize the deeper layers above the rib. Then infiltrate the intercostal muscles until you enter the thoracic cavity with a needle. Make your skin incision 2 to 4 centimeters long and parallel to the rib. Now use your surgical clamp to dissect the subcutaneous tissue. Perforate the pleural membrane using your surgical clamp. You can use your index fingers to prevent deep perforation that might damage the liver or other tissues. Now widen the intercostal wound using your index finger. Introduce the tube in the thoracic cave. You can see and hear air escaping through the tube. The tube is oriented in posterior and upward direction. Place enough sutures to prevent air suction. Use suturing wire to keep the tube into position. Keep sterility in mind when connecting the tubes, and beware to fill the drainage canister device beforehand. Start the vacuum and see how the air bubbles in your canister device. Adapt the vacuum if necessary. And finally, take a new X-ray to check for the tube position and the lung expansion. Thank you for watching this video, and please visit medicsformedics.com for more.